IBS is a syndrome. Typically, peristalsis is the normal wave-like motion throughout your intestinal tract that propels food once you swallow it all the way through to the act of defecation, to elimination. What happens in irritable bowel syndrome is the normal synchronized waves of peristalsis. If you think of them like an ocean wave gently rolling into shore, what happens in IBS, it's like the ocean in the middle of a hurricane or a tornado. The waves are all bouncing all over the place. You have no synchronicity to it. And as a result, people have a lot of symptoms of gas, bloating, abdominal pain. Classically, women will say, I wake up in the morning, my abdomen is flat. As the day goes on, I look like I'm 9 months pregnant. A lot of cramping and a lot of discomfort associated with IBS. We also know that IBS tends to occur much more in women, and it's also triggered by stress. And women get it more because women, unfortunately, really have lousy bowel habits. As a whole, as a population, women in the United States, compared to men, really have poor bowel habits. Women are notorious for holding the urge. We don't want to go in a public restroom if somebody's in the stall next to us. We'll hold it. We'll stifle that urge till we get home into our own commode. We won't typically want to use an outhouse. If it's a public park or a picnic and there's outhouses, women won't go. They'll hold it. And as a result of that, we have paralyzed some of the last nerve endings in our intestinal tract and subsequently lead to diseases or syndromes like irritable bowel syndrome. This is a study that was done on IBS, and basically they took 102 patients between the ages of 18 and 65 and split them into two groups. One group was told to exercise every day, the other group was not. They all had access to a physiotherapist to call for support because we know that emotional support is valuable for people with IBS. Remember I said that it's triggered by stress. It is interesting that for many women, IBS, and men alike, IBS happens on the weekdays only, when they're at work. It doesn't happen on the weekend, doesn't happen on holidays, doesn't happen on vacation. It really seems to be a disease triggered by a lot of stress. Fundamentally, these two groups of people with irritable bowel syndrome were split into two, and the one group was advised to exercise, just walk, anywhere from 20 to 30 minutes, 3 to 5 times a week. So not even a lot of exercise, just regular exercise. They, prior to the study, rated themselves on what's called their average symptom score. So a symptom score is basically how much they felt discomfort. At the end of 3 months, the group that exercised on a regular basis, a couple of times a week for just a few minutes, reported significant reduction in their symptom scores. Vast improvements to the tune of close to 23%. Close to 51 points were reduced off of their symptom score when they exercised. And I argue, and this was published in the American Journal of Gastroenterology, I argue that the gastroenterologists in this town, because I have a lot of patients that come to Georgia Bariatrics with irritable bowel syndrome, and I ask them, what did Dr. XYZ tell you to do for your IBS? And it's drugs, it's things that paralyze the bowel, it's drink more water, it's a few dietary guidelines, but rarely, in fact, never, have I heard a patient at Georgia Bariatrics tell me that their gastroenterologist told them that it was important that if they would walk 2 to 3 times a week for 20 minutes, their IBS symptoms would be reduced dramatically. And that's free, folks. Exercise is free. Not only are we asking you to walk, as opposed to a gym membership. I'm not against gyms, but when you commit to a gym, it's a huge time commitment. And what happens is the number one excuse I see for people not exercising is they don't have time. So don't make such a big time commitment. Make a commitment that you will walk. I want you walking 10 minutes 6 days a week. However, if you walk 20 minutes 3 days a week, it's enough to promote a tremendous reduction in irritable bowel symptoms.